Hello, my name is Ayana Hazlip, and today I will be doing my presentation on the following approach, which is tech and model-specific child welfare techniques. In today's presentation, I will be talking about the mandatory reporting laws. Mandatory reporting laws represents one of child welfare's most fundamental yet controversial policies. Of course, these statutes require designated professionals to report suspected child abuse or neglect to authorities. While all 50 states have implemented mandatory reporting laws, significant variations exist regarding who must report, what circumstances trigger reporting obligations, and what penalties exist for noncompliance. This presentation explores why mandatory reporting generates such passionate debate with child welfare circles, examining both its protective intentions and unintended consequences that affect vulnerable families. I'm going over the history, context, and evolutions. The Child Abuse Prevention and Treatment Act of 1974 established federal guidelines for mandatory reporting. Those states retain authority over specific implementations. Initially, reporting requirements applied primarily to physicians who might observe physical abuse. Over decades, legislators progressively expanded the list of mandated reporters to include virtually all professionals working with children. The expansion has dramatically increased reporting volume. However, the rates remain concerningly low, typically around 18%, suggesting that the yes majority of investigated families ultimately face intrusive investigations without identified maltreatment, raising questions about, of course, system efficiency and family impact. Some of the ethical dilemmas in practice. I stated that the mandatory reporting creates a lot of ethical tension for social work practitioners, while child safety remains paramount. Reporting laws require interventions based on suspicious rather than confirmed maltreatment, potentially violating families' privacy and Research indicates that families experiences poverty, substance use, or mental health challenges often avoid seeking services because they fear mandatory reporting will result in child removal rather than supportive assistance. Additionally, reporting involves subjective judgment influenced by reporters, implicit in biases that contributes to documented racial disparities. Social workers must navigate the contradictions between legal obligations to report and professional values, emphasizing client self-determination, culture, humility, and least intrusive interventions. For the racial disparities and system impact, I stated that mandatory reporting laws produce stark racial disparities. That mirror broader social inequalities. I said that Black and dangerous families face investigations and removal at rates significantly exceeding their population proportion. Even when controlling for actual maltreatment occurrence, research suggests multiple contributing factors, implicit biases among our color, like white people, mandated reporters. I said the economic disadvantage, making poverty indicator visibles and mistaken for neglect. That's mistaken for neglect and different like community surveillance, with poor neighborhoods experiencing like greater oversight. For our Caucasian people communities particular. Child welfare involvement represents ongoing history trauma connected to broader school policies and forced like family separation. For the alternative approaches and reform, I stated that the recognition of mandatory reporting limitations has generated interest in alternative approaches that prioritize family support over punitive. I don't know how to pronounce that. I think it's punitive investigations, different response systems that allow child welfare agencies to screen reports and provide voluntarily service to lower risk families rather than formal investigations. I said showing promise and reducing unnecessary intrusion while maintaining safety. That's a very good factor. Many advocates argue for investing in community-based prevention and addressing the root causes of family stress rather than investigation symptoms. Policy reforms targeting implicit biases, training, community oversight, and culturally responsive practice aim to reduce racial disparities. These interventions reflect growing consensus that is effective to like the child protection services that require balancing accountability with support, ensuring families receive help rather than punishment. For some of the implications for social work practice, I stated that the social workers must approach mandatory reporting with both legal compliance and critical consciousness, understanding reporting as an impacted tool that enables throughout practices that consider family context, available alternatives, and potential consequences. I said that practitioners should advocate for system reforms addressing identified problems while fulfilling current legal obligations. This includes supporting policies that fund preventions, reduce racial biases, and emphasize family preventions when safe. Cultural humility requires examining our own biases and considering how social inequalities influence our perceptions of families. Finally, when reporting becomes necessary, social workers should support families throughout investigations, connecting them with resources and explaining like the whole process, and also maintaining therapeutical relationships whenever possible. Embodying social work's commitment to embodying social work commitment to dignity and justice.